All right, we're going to go ahead and get started. Thanks everybody for joining us today. This is our August monthly Utah Children's Care Coordination Network meeting. It sounds like quite a few people are still joining us, but we're excited to have you all here today. And I'll give you just a little bit of an overview of our agenda. Today we'll do some announcements. We're going to spend a little bit of the first part of the meeting talking about what's happened with the medical home portal in the last month. And then we'll have some time for a case share and brainstorming. And our learning session today is going to be all about bullying. And then, as always, we'll wrap up with our evaluation and some questions at the end. Our evaluation questions and wrap up at the end. So if you haven't had a chance already, you can go ahead and rename your profile up in, mine's showing in the upper right-hand corner of my picture box. I see 3 little dots, and you can select rename from there. If you can add your agency and your role, that just helps us get to know each other virtually through this virtual setting. It's been several years now, but these meetings used to all happen in person, and we always used to have a nice mingling before and after to get to know each other, and that's just not as possible anymore, but it's helpful for us to all try to still get to know each other virtually. If that way we need to reach out between meetings, we know who each other is. So we'll take just a second to rename yourself, add your role and your agency to your name. That would be great. And then we're going for announcements. Again, as always, we like to remind people about the Spark study. It's always ongoing. We encourage you to enroll any families or patients you come across with a new diagnosis of autism into it. And there's the information there about who to contact. It also goes out in the notes after the meeting, so you don't have to worry about furiously writing it if you don't need to. And then we're going to jump right in today to a little bit about what's happened with the medical home portal. It was right after our July meeting, or right around the time of our July meeting last month, that the portal went down. And what happened was that there was actually a pretty vicious software hack on the site that caused the University of Utah security office to quarantine the site. They were afraid that it was going to be used to attack other applications in the university. And they recommended doing a full rebuild and relaunch of the site, which it just kind of came down to the fact that we didn't have the resources or time to do. It would have taken several months to relaunch and rebuild. We were in a tricky spot with funding anyway, and had been hoping for this licensing opportunity to go through for almost the last year now, and it just hadn't. And then the site crashing kind of compounded things. So our administration made the decision to not restore the site, and it has been permanently closed. So we wanted to, and Eric, if Eric's on the call, I know he wanted to have just a little bit of a discussion. We don't have too much time today, but we'll maybe spend about 10 minutes on this, just to get some feedback from all of you about the impact this has had. So I actually have a little poll that we're all going to do at the start here. Let me get it up. So if you take a few minutes and just answer there's just 4 questions here to kind of get an idea about your use of the medical home portal, how this closure has impacted its use, and then maybe what other resources you're turning to. So I'll give you all some time to answer these questions, and then we'll have a short discussion about it as well.
And Athena, I am on the call. I was just going to say to everybody, we're really interested in this information at Department of Health and Human Services, because with the closure of the portal, we're looking for some alternative solutions regarding directory, possible ways to house some of the parent material and articles. We're still looking at some of the copyright issues that may surround that, if any. And so there's a little bit of work down the pike, but your answers on these questions will really help us to look at some possible solutions and ways that we might move forward at DHHS to help provide some type of a resource that could be useful for any of you as you continue to work with families of children with special healthcare needs.
Great, and I'm just going to leave the poll open for a little bit. This is as you're thinking about these questions and answering them, this might be a good time to just kind of open it up for some discussion and or questions as well. I know this is a really sudden thing, and so I'm happy to try to answer questions as best I can about what occurred and or other questions you guys may have as you're looking at these questions. It looks like I've had about 7 people respond. We'd love to have more input than that. So if you can just take a few time to answer these 4 questions, that'd be really great.
I don't know where the poll went. I was typing in it and it disappeared. I don't know what happened.
That happened to me too, Athena. I was typing in it and the poll disappeared.
Here, let's try that. Let's try this again. Sorry, it looks like it might have timed out. There we go. Thank you for letting me know. Yeah, I wonder if I can put so it doesn't time out. I don't know I don't know what the time on it is, if it's like 60 seconds or something. I didn't think about that, but thank you for letting me know. I can combine the results later, so.
I'm just too slow. My answer was too long. It just keeps timing out. That's
yeah,
okay.
it timed out again. I don't know if it saves it when you come back.
I'm so sorry, guys. I didn't know that this would happen. We'll relaunch it one more time. I could, like I said, I can combine all these on the back end, so. It looks like it's 60 seconds is what it times out at.
Okay.
And we, like I said, we wanted just to have a short discussion about this too. So we're happy to hear your feedback in person as well. If you have some things you want to comment on or talk about other resources that you're maybe going to now that the portal is not available anymore, or even ideas, I think this would be a really great opportunity to kind of brainstorm some other solutions that might be helpful as we move forward. So. All right. Did anybody not get
It timed out again.
I was going to say, did anybody not get a chance to do the poll that wanted to? I'm happy to relaunch it one more time.
Yeah, it's that number 4, that's the free response that you're trying to type as quickly as you can, and you just can't quite get it in quickly enough.
That's the one we can have more of a discussion about too, which might be helpful.
Right.
So we'll let people answer here if they haven't had a chance to, and then I can take notes on the last part. Seems like it's timing out quicker each time. I'm not sure how that works, but. All right, did anybody have anything from that they'd wanted to share in person, especially around that last question, like what other resources are you using? or websites or applications? What do you go to to support your work with children and youth with special healthcare needs?
Athena, this is Natalie. I use the American Academy of Pediatrics website as well as Utah Parent Center. I also use Up to Date. I think the thing I'm going to miss the most is the parental side, like somewhere that I felt like I could send parents to find accurate information that was free to them. You know, like I have access to some Up to Date, but parents don't have access to those kinds of things. They're expensive. So I will miss most, like having the ability to send parents to a safe place that I know that they can find reliable information. It's one spot. But I do think, you know, we have lots of resources available to us. It's just, you know, not one-stop shopping so much anymore. So I'm going to really miss what you guys did.
Thanks for that input, Natalie.
I can piggyback up on that. So I'm here representing Utah Parent Center and Utah Family Voices, and we're one of those organizations that really did use that portal multiple times a day, every single day. And so right now, like again, for recommendations on doctors and agencies, I kind of am back to, yeah, just relying on Google or reaching out to other, you know, parent Facebook groups, you know, like, hey, who's recommending this or who sees, you know, what doctors for this. But again, there really isn't a place where I've always felt so comfortable sending parents to Medical Home Portal, knowing that, yeah, it was research-based information, it was reliable sources, and that it was being vetted, you know, by our special needs doctors and families. Like that was such an important piece and so sellable, you know, like, so again, that's been really hard for us to replace. And yeah, we maybe relied on that too much because we haven't found another alternative that just worked so well and was so trusted and stuff.
Thank you for that feedback.
Maybe I can ask this question. With knowing that the portal will not be coming back up, what is something you would like to see? What would be helpful or useful to you to have in a community resource that everyone has access to that would help you make those types of connections, basically be a medical home portal version 2.0, if you will. You know, it's not going to be called medical home portal, but you know, it would be something similar yet different. But you know, if you had a wish list, what would be something that would be helpful to you?
Sorry to dominate, but this meeting, UCCCN, needs to continue. I don't know what the relationship is, but the ability that we have to still talk to each other, to use our listserv, that we can reach out to one another. So to me, I'm just hoping that this portion of, I don't understand all the funding, maybe I should have, but what happens to this group?
Rest assured, UCCCN is continuing. So this group will continue, and maybe this is an opportunity too for us to rethink a little bit about what this group does provide and recommend. And I don't know, maybe we can start some resource and list sharing site that's not as complicated as the medical home portal was. Maybe it's a more stripped down basic version, but something that would be kind of like a care coordinator 101 resource guide or something like that. Although I know Utah Parent Center has a lot of this kind of information collated in their site as well. So, you know, we're just kind of trying to think about all opportunities here. So.
Yeah, and just speaking from the DHHS side, we have no plans for Utah Children's Care Coordination Network to go away. So we are, you know, re-examining contracts with, you know, how that will work. And we fully anticipate that Athena will keep being our monthly MC for this and organizing and helping us do this. big shout out to Athena for, the excellent job that she's done since Mindy left. And we anticipate that, this will continue forward. So we're working on that piece right now. And then again, just try to figure out what would be a really, great resource in addition that could, kind of serve as, like I said, Medical Home Portal 2.0 or something like that. And, nothing turns on a dime. This is the state. It takes a few minutes to get things done, but we're really hoping to be able to have, something that can be user-friendly, shared, usable for all of our community partners to help be that vetted, trusted resource guide. And we work very closely with Utah Parent Center, so we're definitely working with them to help come up with some solutions. We're also talking with 211 to see how they can help us in this process. So we hope to be able to bring some ideas and some things back to this group as we have some news and as we are making progress in that endeavor. So more info to come, I guess.
That was one of my suggestions, is 211. I'm actually working with them on a separate project to have like a training for the answer line specific for perinatal mothers that are experiencing homelessness, kind of like how to guide them where to go. So I think that may be a good starting point just to kind of fill the gap if they're willing to get that information online.
Yeah, we met with them briefly the other day, and they were terrific. And sounds like they're very solution oriented. We just haven't, kind of had that problem solving meeting yet, as far as kind of saying what are ways that we could go, what are some additional ideas. We know there are some national platforms out there, but we really feel like having some 211 input would be a great idea as well. So we're exploring all options right now, and definitely want input from this group. So if any of you have ideas or things that you would like to see, we would definitely welcome that. You can communicate that, to me or to Athena. She will definitely get that information back, if you would like, back to me, if you think of any ideas or wants or wishes for that.
Does anybody else have anything they wanted to add to this discussion? All right, well, I'll get those poll results collated, and we'll look at those too. So thank you for your input on that. I know it was, like I said, a kind of a really sudden thing and a resource that's been built over 20+ years, so it's hard to see it just kind of suddenly go away, but we are hopeful that we can kind of come up with some alternatives as well. So
Right, thank you, everybody. And I'm going to sign out. I need to go to maternal child health block grant review with her Fed. So wish me luck, and I'll see you all later. I thank you very much for your input today. And again, please don't hesitate to send any comments or ideas my way. Thank you, everybody.
thanks, Eric. All right, for our case share today, we're going to turn some time over to Kendra Torgerson from the Central Utah Health Department.
All right, thanks, Athena. Can you guys hear me? Okay, great. So I'm just going to kind of share a case. It's one that I'm still working on. This kiddo started about a year ago, and some of our cases are like a one and done. We help them find resources, and that's it. Others, we kind of hold their hand throughout the process from beginning to anytime they need help. So this one is a 3-year-old little girl. She was referred to me for speech and sensory, and then her mom also had concerns for autism. The first thing I did was reach out to the mom and just do a quick intake, get more of a feel for the concerns she was having. And she let me know that her daughter was 3. She was nonverbal completely. She would babble, yell, or pull at her mom to what she wanted. She didn't like loud noises such as blow dryers, vacuums, and she would cover her ears and she'd run away. She was having some sleep problems. She was a picky eater. And then lastly, Mom told me that she would get aggressive and angry as well. I reviewed our consent forms with her, kind of went over the telehealth visits and our privacy practices. And then I also kind of went over my role as what I do as the Children with Special Healthcare Needs Coordinator. She wanted to do an intake assessment and evaluation, so I set her up with our nurse practitioner through telehealth services. And our nurse practitioner is amazing, and she goes through the medical history. She really gets to know the family and the kiddo that we're working with. And sometimes two brains are better than one. So our nurse practitioner recommended that this 3-year-old get tested for early preschool and that we help her get a speech eval. The school will do speech evaluations and also help the child with occupational therapy and speech. However, this mom was not on board with the idea of sending her daughter to preschool. So we needed to come up with another way to help her. In my rural area, the only speech therapists we have available are the ones that work for the school or early intervention. We don't really have anything outside of that. So that means they cover up to 3 years old, and then there's that gap until they start going to district school. However, with the Children with Special Healthcare Needs program, we also have a speech therapist up north who will do speech evaluations through telehealth. And so that's what we did. We also thought the Speak Easy app, which we have, would be a great addition for this child, and the mom agreed to that as well. So she was tested and diagnosed with developmental disorder of speech and language. Let's see. So as I talked about mom's concerns earlier, you can see there's also some sensory processing concerns. The loud noises, difficulty with sleep and behavior. So the next thing I did was do a sensory profile for this kiddo, and then set mom up with Joel, our occupational therapist within the Children with Special Healthcare Needs program. I don't know if you guys are familiar with sensory profiles, but it's like a list of questions for the parents, and then they rate behaviors like sometimes, never, always, frequently. An example would be holds the hands over ears to protect the ears from sound. And it helps the occupational therapist with where the child is struggling sensory-wise. So we made that telehealth visit, and we had Joel and mom on there. And sometimes we get the kiddos, and that's always fun too, to interact with them. So Joel explained what sensory processing is and how it can contribute to her behavior. He gave her a sensory diet and some things to try, and then follow up in a couple months to review those suggestions. So when we followed up with this kiddo, she had started trying new foods, and then mom had concerns with hearing. So we addressed that at the health department where I work, I should say. So later, mom decided that she wanted to send her daughter to district preschool. So we helped her get in contact with the district. She also brought up concerns with autism and really wanted to get her tested. Autism testing, as you know, can be really expensive, and not all autism specialists take every insurance, which can be kind of a struggle. We don't have a provider in our area that does autism testing, and so we have to refer them to someone up north. We do, however, have a psychologist that is great, and he goes to Price a few times a year, and he takes Medicaid clients. This particular kiddo had private insurance, and so we had to go through other options. So we decided to go through ABS Kids, and they also do ABA therapy in my area. We only have a couple companies that do ABA therapy, and that's one of them. After months of waiting, she was finally tested and diagnosed with autism level 3 with speech delays. So right now she is on a waiting list for ABA therapy. And right now she is starting school. I think she will start today actually. So last year she went twice a week, and this year she's going to go 4 times a week, and mom will take her and pick her up. And she has an IEP in school. She gets speech therapy. The school's starting her with a new program on her on an iPad. They have some accommodations so she can bring her favorite stuffed animal that kind of helps her regulate. She brings lip gloss and snacks. She has started to do like pretend play. Her mom says she plays with Barbies now, and she didn't do that before, which is kind of fun. And she's getting to where she'll go brush her teeth. She likes the electric toothbrush. That helps her a lot. Last, mom had some concerns with a dentist. She hasn't been to a dentist yet, and she's worried about that. I don't know if you guys have any ideas of good dentists maybe up there. We do have a pediatric dentist here. You guys dealt with any autism specialist dentists? How did the kids do with them?
Thanks, Kendra, for sharing that case. Does anybody have any good dental recommendations for Kendra?
How
And
far north are they willing to come? I feel bad, but
Where did you say?
well, I was just wondering how far north, because
Oh, yeah, I'm not sure. So we're down in Richfield. But I think to make it a better experience for her where she's level 3 autistic, I think, I'm not sure.
because I know a lot of our families go to dentists, even just like their regular pediatric dentists, and just really do talk to them about what their needs are. And I think that more pediatric dentists are willing and able to help, again, mostly with that sensory piece. But it's, with autism, yes, it is the whole experience, and it's someone who's comfortable dealing with behaviors. Because again, my daughter will have behaviors. That doesn't mean that she's not that she's fighting the process. She actually loves going to the dentist, but she's still loud and has behaviors. She did see up here, but it's literally in Sandy off of Creek Road. I can give you I'll link you to him because he's actually received like best practice awards. His name's Barney Olson. He does Creek Road orthodontics and pediatric dentistry. So again, if your kid needs anesthesia, he has rights at, different hospitals, including primaries. But he's received some awards for best practices for special needs kids. Because what he does is, like, your first visit is just coming in and walking around. You don't have to do anything. You don't have to meet anybody. But they'll schedule a time where you can just come in and let your kid run wild through the office. No joke. The second time they do ask that they try to let them just put them in a chair. They have 3 private rooms, 4 chairs that are kind of more open. And then they have a very, very private, like no windows, kind of room where that has very minimal equipment in it, where they can just sit in a chair. They work up to then like, can we just count your teeth? Can we just count your teeth? That's all we're going to do. Hands off. We're not, if you don't, we're just counting your teeth. So they really build up this tolerance and make it a good environment. The other funny thing that they do is they all wear the same scrubs each day. So it's different every day, but you won't know the difference between your hygienist, your receptionist, and the actual dentist when he comes in to do work, because they're all wearing these cute, fun, scrub jackets that everybody looks the same. But he also can help, again, like coach other practices in that. So I'll just link that, but that's some ideas that you can ask for those things to other pediatric dentists in your area as well, though. Can we just do this slow? Can we make this a process? So that's just an idea. Sorry, that was a long one.
No, thanks. If you share that with me, that would be great.
The other thing he has on here is he has a full social story about their office, which is cool. Like, you put your kid's name in And it'll say, Maya's going to the dentist today. When she comes in, she'll see receptionist Chris, and then you'll talk to Kenda. Like, it's really cute. Like, it has their name in it.
Thank you for sharing those resources. Does anybody else have any others?
I know my granddaughter has some sensory issues and she sees Justin Moody in Payson. And I don't know specifically what practices he uses, but some of the ones that Colleen mentioned, you know, I'm sure if she asked for that, I'd like a Doc McStuffins start, you know, to dentistry. I'm sure he would accommodate that, but that's a little bit closer, you know, than Sandy to where you are. So.
Thanks, you guys.
All right, thanks everyone. If anybody else has any other recommendations, you can throw them in the chat and I'll make sure that they go out in the notes as well. And then, excuse me, we do have just a couple minutes. If anybody else has any other announcements or cases you wanted to bring or questions you wanted to ask this group, this is your time to go ahead and bring up your own other difficult cases or questions or new resources you've heard of that you want to share with this group. All right, well, it sounds like we don't have any nobody wants to share any additional things today, and that's okay. We will dive into our learning session. Today is all about bullying, and we have two presenters today. We're first going to hear from Becca Rae, who's the Bullying Prevention and Behavioral Specialist from the Utah State Board of Education. And then she'll be followed by Michelle Creek again, who was with us last month as well, who's the Statewide Education Project Coordinator from Utah Parent Center. So we're really looking forward to this presentation and learning more about bullying. So I'll turn the time over to Becca Rae. I'm going to go ahead and stop sharing.
Right, let's get this situated really quick. Okay, can I get a confirmation that you guys can see my slides and hear me? Perfect. All right, so yeah, good morning, everyone. Thanks for the opportunity to talk to you all this morning about bullying and the resources that we have here in our state. As Athena said, my name's Becca Rae, and I'm a prevention specialist at the state board, and I specifically focus in bullying prevention and behavior support. All right, so right now, bullying is one of the top 5 concerns that schools are requesting support with. And so I just kind of want to dive in a little bit to what that's looking like in our state, kind of the effects that it has, and how we can support students that are experiencing bullying. There have been some bills passed in the last few years that have changed how schools are responding to bullying as well. And then lastly, I'll share some resources that you can review and share with the parents of the children that you serve. I do want to mention as we go through these slides, I might say the word LEA a lot. And that's just local education agency. It's just a term that we use to describe both districts and charters combined. So first, I just want to make sure that we have a clear definition of bullying. So from state to state, there are going to be some nuances in the definition, but you'll consistently find these terms or their synonyms. So when you think of bullying, just remember PRI. So P for power, and that is an imbalance of power. And that can range anywhere from an age difference with one student being older, to height difference, one student being bigger than the other. Or maybe in regard to the families that you guys serve, students that are being bullied by their peers that have special healthcare needs. This behavior also needs to be repeated and intended to cause harm. So if it occurs once, it should absolutely be addressed. But when it's repeated, that's when we're looking at disciplinary action associated with bullying. And then another question I get a lot is regarding intent. And the Utah legislature has expanded this definition quite a bit, so it's a technical term, but to kind of help flesh out the intent, they say that, let's see, a reasonable person under the circumstance should know or foresee that the behavior will have the effect of causing harm, whether it's emotional, physical, or even property damage. And so this is a little bit easier to determine as well if this behavior is repeated, because you would know if it caused harm. So along with understanding what bullying is, I really want to highlight the difference between conflict and bullying, because conflict is going to be your disagreements or arguments where you're both expressing your views. And in normal conflict, children are going to self-monitor their behavior. They read cues, and when they realize that they are hurting someone, they'll typically stop. And so that's just a natural part of relationships as people grow and change. This provides opportunities for learning conflict resolution skills, problem solving, interpersonal skills. And even if this were to escalate into an emotional disagreement, there's still opportunity for learning. But it's when this behavior continues, even when it's hurting someone, or there's something that's unequal in that relationship, then we're no longer looking at conflict, and this has kind of become bullying. And the reason that this is important to determine the difference between the two is because if a student reports to you that they're being bullied, the message that they receive from us should be that bullying is wrong and we are going to do everything that we can to stop it. Whereas if they're reporting that there is some conflict going on, we can support them with helping them learn some mediation strategies or problem solving. So here are just some examples of some different types of bullying. So you've got your verbal bullying, and so that's going to be your teasing and your name calling. Social bullying, maybe there's some rumors being spread, or peers that are isolating another student. You've got physical, you're hitting, you're kicking. And then cyberbullying kind of captures any sort of bullying that occurs using electronic means. And then sexual, and that would be your sexual harassment. And so I do want to highlight, of course, that if sexual harassment is reported to you, that you should immediately get the appropriate personnel involved, whether that's, depending on the seriousness of it, that might even be law enforcement, DCFS, administration, the Title IX specialist. Here are just some resources that we have in Utah that provide us some data on bullying in our state. So this includes the school climate survey, and that's conducted at an LEA, so school level. And I've linked the data dashboard here, and I'm happy to share out my slides after this as well. So you can look into some of these resources. But for example, the school climate survey it has questions that ask things like, where do you most often see bullying on your campus? And we know that for elementary students, they most often see it on the playground, whereas our middle and high school are reporting that they're seeing it in the hallways the most. We also have data from Safe UT and SHARP, which is the Student Health and Risk Prevention Needs Assessment, the School Law Enforcement and Discipline Action Report, and that tells us that 3% of all disciplinary incidents reported are bullying. And it also breaks these down by demographic. So we also know how many of these students are being bullied based on a protected class. And then some national resources as well. We know that nationally, 19% of students are reporting being bullied. And when comparing that to the Utah average, they're pretty comparable. So really quick, I want to focus in on one of these resources. So Safe UT. Governor Cox has said that he encourages the Safe UT app to be downloaded in every school on every smart device possible. So for those of you who might not be familiar with SafeUT, it was developed due to Utah's high youth suicide rate, and it connects students, parents, and educators to a licensed crisis counselor at the Huntsman Mental Health Institute. And something that's really awesome about this is they've since developed 2 additional apps. So they now have an app for frontline workers and an app for the National Guard as well that would connect those 2 groups with the crisis worker either through call or through chat. But what's really cool about the student app is there's an option for them to submit tips. And so when a student submits a tip, it's reviewed by someone from Huntsman Mental Health Institute, but then it's redirected to the school administrators to respond according to their policy. And so we know that about 12% of all tips sent in through SafeUT last year, at least, were bullying. In the last several years, we've seen 2 major bills on bullying pass, which impact how our schools are responding to bullying complaints. So in 2022, House Bill 428, also known as Izzy's bill, was passed. So Izzy was a 10-year-old student in Davis County who completed suicide after being bullied at school. And so this bill added some required trainings, required steps for investigation, and then data collected on demographics. So that's the data I was talking about with the school disciplinary incident report. And then this year, House Bill 84, which is the major school safety bill you might have heard of, was passed, and it actually had a pretty significant section on bullying. And so that section added on to the requirements of House Bill 428, and now it requires a communication plan with parents that's documented, and as well as an action plan to support students. And this isn't just to support the student who is bullied, but also to support the student who was bullying and making sure that it doesn't continue to occur. And then lastly, also added that there will now be disciplinary action for students who record and share incidents. And so this is kind of to help mitigate the issue that we're seeing with cyberbullying, where someone records an incident and posts it, and then it goes viral because people are spreading and sharing it. And so there's now discipline for that. So here are just some warning signs that you can look out for a student who might be being bullied. This includes the unexplained injuries, maybe some missing possessions. They might report feeling ill, but there's no clear reason why they might be ill. Frequent nightmares or school avoidance. They might run away from home or engage in self-harm. And so these are just some things that we want to look out for to identify if we need to really sit down and have a conversation with a student to see what's going on. So in addition to those warning signs for a student who's being bullied, we also know that bullying impacts the entire climate of a school. And so this is just a list of examples for how bullying impacts not just the student who's being bullied, but also the bystanders and the student who is bullying. And this is significant because we know that if there are reports of bullying on a school campus, there might be bystanders who witness it, and they might not feel safe at school. And so maybe they are chronically absent because they are avoiding, or maybe the students who are engaging in the bullying are also participating in some other concerning behaviors that need support as well. So why does it happen? Students don't just bully to bully or bully to be mean. Bullying is very complex. It's a part of a much larger concern that typically accounts for multiple variables. So it could be peer relationships. They may engage in bullying so that they can fit in. It could be their family or community environment. Maybe they witness violence or they don't have a trusted adult involved in their life. It could be emotional factors. So maybe students who have experienced trauma, they are more likely to bully or be bullied. And then also the school climate. So students might realize that if adults aren't listening to them, if they don't feel heard and bullying isn't being responded to, that could encourage them to engage in it more or prevent them from feeling safe enough to report. So in order to prevent bullying, the research has told us that kids who know what bullying is can identify it better, especially when it's happening. So oftentimes you'll talk to a child and they'll report some bullying is happening, but they don't understand because that person is their friend. And they don't understand that bullying can still exist in that relationship. And so really teaching them and clearly defining what bullying is so they can see it when it occurs can help them for what to do when it happens and if they need to report it. They need to know how they are supposed to respond if it does happen. So some schools have adopted like interventions such as stop, walk, and talk. And so that is when someone's being bullied, you tell them to stop, you walk away, and you go talk to a trusted adults. And so students just need to know how to report bullying and as well as support the student that they see being bullied. And then the trusted adults should make sure that they're always maintaining a good communication with their students so that students feel safe enough to report it. And another way that we can support students is by building and supporting protective factors. So we often talk a lot about risk factors. And then the protective factor framework is an evidence-based prevention work, and it reduces the risk of unhealthy and risky behaviors such as absenteeism, bullying, substance use, suicide. And these are just some examples of some of the factors that we can build into our work when talking with students. So concrete supports, that's going to be your access to services that meet your basic needs. So that's your shelter, your food, sleep, safety, knowledge of development. So teaching kids that intelligence isn't fixed and that it can be influenced through hard work. Social connections, so that's your healthy, sustained relationships. Oftentimes when we talk about mental health, we say connection is the key or connection is the cure. Resilience, so being able to manage stress when faced with adversity, and then your cognitive, social, and emotional competence. And that's going to be your self-regulation skills and your social awareness or executive functioning skills. So how can we support? If a student reports to you that they've been bullied, they need to know that it's going to be handled and that they are heard and that they are safe. And so we should seek out resolution to prevent it from happening again, and then try to understand what happened so that we can support them through coping skills or stress management. And if this is a chronic issue, we know that bullying is considered one of the ACE, so the adverse childhood events, and can be traumatic for students. And so if this is a chronic issue, they might need professional support, whether that's referring them to just meeting with a school counselor or an outside referral. I do want to highlight some different action items if a child reports that they're being bullied online. So when someone says they're being bullied online, we don't want to respond to, we don't want to forward, because we just want to prevent that message from going viral, from spreading anymore. And so you'll just keep evidence of it. So recording the date, the time, description of the incident, save it if you can, print screenshots. I know, so Snapchat is a social media platform that is often used in bullying. And one of the barriers with this is if you take a screenshot on Snapchat, it will notify the person that sent it to you. And so that can kind of prevent kids from feeling comfortable with saving or documenting when it's happening. And so something that you can do is you can take another phone and take a picture of the phone with the Snapchat on it. That way, no one's getting notified that you're documenting this. You should immediately block the person that's cyberbullying and then report them to whatever social media site it is, so that they can take action, because typically that is against the terms of service. And then if appropriate, you might even need to report to law enforcement if there are any threats of violence or if there's child pornography involved. Something that we're seeing a lot with our older students right now is if you've heard of AI deepfakes, Recently, the FBI issued a statement that this is considered possession of child pornography. And this is when students take images and use artificial intelligence to kind of add the face of a peer onto a nude body, and then they spread that. And so students don't realize that this is a serious crime. And so that's something that they need to be informed of, and also something that should be enforced and immediately reported. And then, of course, you'll want to report to the school if it involves any students in school. So in the state of Utah, schools are allowed to address behavior that's occurring off campus if it's impacting or disrupting the school environment, especially if school equipment was used. And so that's just something to keep in mind, that if it's impacting kids when they go to school, that the school can also support in handling. And the federal Stop Bullying Initiative has some really great information on how to talk about bullying, depending on what role you play in a child's life. Some of these suggestions include parents create trust with children by initiating open and honest discussions, where you can communicate your values and learn about your child's experience. And that can make them feel safer and more comfortable to turn to you if they experience it. You can have thoughtful conversations, just those routine conversations that are encouraged, where you check in at dinner or on the drive home from school. You're just talking about their day and listening and showing that you trust them. You want to ask open-ended questions to get kind of some more information on what happened. So if they say something concerning, you can ask, well, where did this happen? Or what was going on right before this happened? Does this happen often? And so this can help problem solve the next steps. Some also really great resources on the stopbullying.gov. It has a section for like healthcare workers, for pediatricians, for if a student wants to talk to an adult. It has all of the different roles that you can look into for how you can initiate these discussions. Another thing that can sometimes be a little frightening is if you find out that your student has bullied. And so the number one thing is to stay calm and to be open and listen. You want to understand what happened and try to get to the root cause of why this happened, because the goal is to help them learn from this and then work through the reasons that they did it so that they can find some healthier ways to meet their needs. You'll need to, of course, work with the school or the parents to help deal with this as well. But these are just some open-ended questions to help identify what's going on if you find out that your student has engaged in bullying. And then just some things not to say. If you receive a report of bullying, there are some things that we kind of want to avoid, because we want to encourage kids to feel safe talking to us. Even if they participated in the bullying, we should not be placing blame. Our message should be that no one deserves to be bullied, and we're not just going to ignore it, we're going to address it, and we're going to support. We don't want to encourage fighting, because while a student should absolutely stand up for themselves, that puts them at risk of getting hurt. It also puts them in a place where they could be disciplined, whether that's suspension or expulsion. And lastly, parents are their students' best advocate. However, contacting the other parent directly might escalate the issue. And so the school can be a great mediator in these situations. Another resource that is really great is Stand for Kind. So they were previously known as the Anti-Bullying Coalition, and they've since rebranded to kind of focus on more of the positive work that they're doing. They offer trainings and resources to schools. So they do webinars, they do assemblies, they have a parent toolkit, and they also have a podcast and I think an app for like mental health professionals to get more information. And what's really great is they are legislatively funded. So these are resources that are free, and we're really trying to spread awareness about these resources And their work typically includes bullying prevention, but they'll also talk about mental wellness in general, as well as resilience and how to avoid burnout. And then here is just a decision tree that we often send to parents to kind of help them walk through the process if they find out that their student has been bullied. So maybe if a child comes home and reports to their parent that they've been bullied, first step would be to talk to your student's teacher because they probably know the most about the situation. They might also know the other student that is involved. And their teacher will immediately notify administration, and they're required to have trained investigators on bullying prevention, and will be able to create an action plan to support both students. Oftentimes, parents may not feel heard, or it may not feel that this has been resolved at this step. And so the next step that you can take is you can contact the LEA admin. So that's your district level admin or your charter director, and they can help resolve those concerns. And then finally, your local school board. So they can help resolve these concerns and support with making determinations. Then lastly, we've got the public education hotline. And so parents can reach out here where the concern will actually come to my desk. One thing I do want to highlight is that at the state, we are only able to enforce compliance with policy and rule. We can't make determinations because in the state of Utah, we give local control. And so all of the decisions, if there's a grievance with the decisions that were made, that will still be handled by the local school board. But at the state level, we can go through and make sure that their policy is compliant and that they correctly followed all of the steps in their policy. So for example, when the incident was reported, did they immediately contact the parent within a timely manner? Did they interview both the students involved? Did they collect records to review evidence of the incidents? And just those minor steps along the way that we can check to make sure that they were done correctly. And then also, we don't at the state investigate allegations of discrimination. So that would be the OCR, Office of Civil Rights. So each district or charter, they have a grievance process to resolve these concerns. But then again, if those concerns haven't been resolved, then you can file a complaint with the OCR and they enforce the federal civil rights laws. And so they can offer mediation and a formal investigation process. That complaint does need to be filed within 6 months or 180 days after an incident has occurred. And so I've also got the complaint process linked here as well. And then lastly, just with fall right around the corner, I want to highlight that Unity Day is coming up, and that's October 16th. So Unity Day, it was started by Pacers National Bullying Prevention Center. And this is kind of their way to show a vibrant statement for students who are bullied and for bullying prevention in general. And it's just a really great cause because you can get involved at any level, whether it's just wearing an orange t-shirt that day or you sharing something orange on your social media, all the way to if you want to sit down and have discussions with legislators. So it's really great because it can get the conversation started that bullying is not acceptable and that we are going to do everything that we can to address it. It is not a rite of passage or a natural part of childhood, but students deserve to feel safe, and they'll be able to look around and see all of these trusted adults who might be resources for them if they are being bullied at school. And then this is just a compiled list of all of the different resources that I talked about that you can refer to if a student that you know is being bullied. All right. Does anyone have any questions? I'm trying to find my stop share. There it is.
Thank you, Bree. Or sorry, not Bree. Thank you, Becca. We're grateful that you were able to come today and give us that nice overview, especially how it relates to some of the like legislation and what schools are able to do and not able to do, like where the limits are allowed. Yeah, if nobody has any questions, we will turn time over to Michelle now.
Okay, thank you. Thank you, Becca. That was wonderful. Becca and I collaborated a little bit ahead of time, and I have to tell you that we must share a lot of the same resources because a great deal of my material Becca already had. So I am I am mostly just going to let's see. What are you seeing right now?
We can see your like the PowerPoint tab, but it's not in presentation form.
Okay, let me see if I can change that. Is that better?
Yep. Oh, it's good.
Okay. So I will mostly just add a few items about how it relates to children with disabilities, because that's what we do at the Utah Parent Center. We help parents whose children are impacted by disabilities, and we help them find resources that can help them advocate for their children. And of course, a lot of the resources that Becca shared at the end of her presentation are the same ones that we refer them to, the stopbullying.gov. Excellent. Our website, utahparentcenter.org, has a section of bullying resources. And then the OCR can also be an important asset for parents if they've worked through that chain of command and haven't gotten a satisfactory resolution. So we are going to talk, just like I said, real briefly about the angle of students with disabilities as they are affected by bullying. My name is Michelle Creek, and I am a parent consultant at the Utah Parent Center. And we, of course, were heartbroken by the problems with the medical home portal, but we do have some of those same resources on our website. So that's a good place to refer parents if they're looking for information about specific disabilities and resources out there. And Colleen is our star at Utah Family Voices. So lucky to have her. So we'll talk a little bit about the statistics and the data as relating to bullying and children with disabilities, how to respond appropriately, which again, Becca did an excellent job talking about, and then communicating with the school. So the reality is that children with disabilities are significantly more likely to be bullied than the general population. Some studies show that children with disabilities are up to 10 times more likely to be bullied than their non-disabled peers. So if up to 25% of the general student population is experiencing bullying, then you can imagine how great a number that is for children who do have disabilities. And, you know, part of the reason, probably the main reason is that when bullies are looking for easy targets, they're looking for children who are already vulnerable, isolated, maybe don't have a large peer support network around them, children who are going to overreact or respond to the bullying in, you know, a large way. And a lot of disabilities, neurodivergency results in that, right? And so it's very gratifying to a bully because they will get the reaction that they're looking for out of a student with a disability. And that student is often very vulnerable then and isolated and alone. So our children with disabilities are extremely vulnerable to being bullied, and we need to then be aware of that, be diligent in supporting those students that are being bullied, and also helping them to come up with a method or a means of being able to stop the bullying and to deal with it. More than 1 out of 5 students in the general population reports being bullied. I know I was bullied and I'm old enough that way back when, you know, that was happening, it was, as Becca mentioned, considered to be just kind of a rite of passage for childhood. You know, you just had to expect it and learn how to deal with it. And there weren't support organizations like Stand for Kind. There weren't programs like Stop, Talk, Walk. You were pretty much on your own. And I know my husband was encouraged to stand up for himself, to fight back. You know, he ended up getting a broken nose at a young age, trying to handle a bullying situation on his own. And so hopefully we've progressed past that, the understanding that this is not a normal part of childhood, that the effects and the trauma of bullying can be deep and long lasting. They can have significant effects on a child's mental health, their self-esteem, their educational experience, even their adult lives. When Becca mentioned the ACEs, right, the adverse childhood experiences, as I'm sure most of you know, those have been linked to lifelong health problems. And so bullying is a really serious occurrence in our children's lives, in our students' lives. And so as adults, the obligation is on us to do what we can to prevent it, to stop it, and to deal with it when it does happen. 64% of children who are bullied don't report it. And often, you know, they're told not to tattle. And so children with disabilities are often told not to tattle more frequently than other children. I know I go over this with my grandchildren a lot, the difference between tattling and telling. And tattling is just to get someone in trouble, but telling is something that you need to do when somebody is being harmed. And of course, bullying has that intention to harm as a component. There's a lot of conflict involved in childhood, but when there's an intent to harm and a repeated frequency and a power imbalance, that PRI that Becca talked about, then that crosses the line. It's not conflict, it's bullying at that point and needs to be dealt with as such. And children who report that should not be then shamed into not tattling, because it's irritating, you know, for us to hear about constantly. We have the responsibility to know the difference between conflict and bullying, and then to deal with it accordingly. 40% of children with autism and 60% of those children who have fewer support needs but are still on the spectrum have experienced bullying, because they do fit that profile often of being isolated and not having a large peer network around them, maybe overreacting or reacting in a way that neurotypical students might find amusing. So again, the vulnerability is much greater there. Now, this is a civil rights issue. The Office of Civil Rights and the Department of Education issued a Dear Colleague letter that said that bullying can become discriminatory harassment of a student with disabilities. And so that's something to be aware of too. If it is repeated, if it is discriminatory because of their disability, it can be considered harassment and a civil rights issue, then that can be dealt with by the Office of Civil Rights. And in Becca's decision tree, there is that option there after, local reporting and investigating has been done. So responding to bullying then, and again, like I mentioned, we've evolved in our understanding of what's appropriate when we respond to bullying as adults, as caretakers, as caregivers, as responsible individuals. The passive approach was big in my day. Oh, just ignore it, just it'll go away. If you don't react, then they'll stop. Well, actually, that's not true. Quite often, the bullying will escalate in order to try and get a reaction out of the person who's being bullied. And so to tell a student that they just need to ignore it is in effect telling them it's not a big deal that you're being bullied. Probably the opposite end of the spectrum then is to encourage them to react aggressively, right? Or to belittle the student who is actually telling that they are being bullied, who's reporting that, to get upset at them because, why is this such a big deal kind of thing? And then that sends the message that, hey, it's okay for us to bully you too. It's okay to be bullied. And of course, that's not the right message. So instead of being passive or aggressive in our response, we want to be assertive. We want to present ourselves as someone that the child can trust to appropriately help them to address the situation in an optimistic, prompt manner, that we are going to send that message that bullying is not acceptable. No one deserves to be bullied. You do not deserve to be bullied. And we're going to find a solution to this together. Quite often when a child is being bullied, they do take some of that blame upon themselves, right? They're often aware that they're different, or they're hypersensitive to the fact that they may not be good at making friends, or they may not be popular, or they may not be talented in a specific area. And so children will very mistakenly sometimes assume that they deserve to be bullied. And of course, we know that no one deserves to be bullied. And we need to make sure that we convey that message to the child. No one deserves to be bullied. Everyone is different. Everyone has different gifts and abilities, but that doesn't mean that anyone deserves to be bullied because they're different. So we're going to help you find a solution to this problem. You need to remain calm, as Becca mentioned. Quite often, if a parent or whoever is actually hearing the report of the bullying responds, in a panicked manner, then that does not help the child. That will actually increase their fear and sense of insecurity. So we do need to represent competence and compassion at the same time, when the child does trust us enough, right, to report that. Oh, I'm sorry. Assertive approach. I got ahead of myself there. So the stopbullying.gov, which again, Becca mentioned, is an excellent resource. Parents, school staff, other adults, healthcare professionals can turn to this as a resource for what they can do when bullying is reported to them. The main thing is to know that we need to stop the bullying on the spot, not let it continue. We need to respond quickly. We need to respond consistently. We need to discuss it openly with the child. And again, convey that message that this is not their fault. And we are going to help them. And we need to do what we can to nurture a safe environment and to help the child have a prevention strategy. Okay, it's not their fault, but it's also not up to them then to stop it. We need to be their allies in helping to stop it and prevent it. And I really liked this Stand for Kind organization, because it really does take community effort, a school-wide effort, a district-wide effort. And districts are required by law, as Becca mentioned, to have a protocol in place when these incidents occur. But a lot of times the environment in the school, the culture in the school needs to change too, in order to make it clear that bullying is not acceptable and it will not be accepted here. And instead, we're going to replace that with a different culture. And so Stand for Kind is doing excellent work. We need to help encourage those self-advocacy strategies, not get irritated when a child is reporting incidents that are concerning to them, where they feel that they have, they've suffered some kind of harm, and that it's been repeated, and that they don't have the power then to stop that. So we need to encourage them to report those situations. We need to encourage them to tell a trusted adult. Again, that talk part, right? Of asking them to stop, talking to a trusted adult, and then leaving the situation. Move away from it. I have 5 sons, and they all wanted to take martial arts when they were younger. And I was a little concerned when, we first went there. I thought, oh, is this going to increase aggression? Is this going to, make them more likely to respond in an aggressive manner to things? And their excuse me, their sensei, bless his heart, the very first day he said the best offense is a fast pair of sneakers. And he said, whenever possible, you want to leave a situation, don't engage, just leave and then talk to someone. So I still think that's great advice that we can give our children. There is a self-advocacy student action plan that is available at pacercenter.org, bullying 411. And you can use this to help the student put together an action plan, so that if they are in a situation where they're being bullied, or they're observing someone being bullied, that they have an action plan ready. They know how they're going to respond in such a situation. And that can be really helpful. And you can also use the IEP plan. If your students have an IEP plan because of their disabilities, things can be incorporated in there. As Becca mentioned, there are different scenarios where bullying is more likely to happen depending on the age. And so build that into the IEP plan, that maybe they do have a peer group at recess. Maybe they do have a peer or even an adult, depending, on the need, accompany them from class to class, or at least have, a visual line of sight on the child when they are in those more unstructured times when bullying is likely to occur. And again, there are all types of bullying. I come from, again, an era where physical bullying was more the norm, or verbal bullying, long before cyberbullying had to be such an issue of concern. But build protections in around those times and places where different types of bullying are likely to occur. And then to be aware that this is a possibility, because people are very creative, children particularly, and can be very cruel because they're still learning those social norms and what's appropriate in personal relationships. And sometimes our students are the bullies as well because they don't know yet, they haven't learned, or maybe they're reacting to being bullied themselves. And so it's important to look at both sides of the situation and realize that both sides, the bully and the child being bullied, need help and need to be coached in the skills that are appropriate for getting their needs met, their social needs met. And then we also have a chain of command that we share with parents. One thing I would add is that Holly Bell at the Utah State Board of Education is another resource in addition to Becca. She is the student and family rights specialist. And so if there's a 504 issue as well, you can contact Holly. But we do always encourage parents to react quickly, promptly, locally at first, and that's going to be the best way to resolve the issue if you can resolve it at that level, because it will be prompt at that level and it will be involving the people who work with the student, the child, every day. But if resolution isn't possible or isn't happening at the local issue, then follow that chain of command up and know that there are options at the state level and then even at the federal level for dealing with bullying that hasn't been dealt with at the local level. We also have a lot of resources on our website as well. If you just go to utahparentcenter.org, resources, bullying, or just use the resources drop-down menu. We have all kinds of templates there that parents and other individuals can use to know how to report bullying, how to document it appropriately, taking pictures, keeping data yourself as a parent is very important. Sometimes we're now getting a lot of calls from parents who say, well, you know, this happened. My child was bullied in the hallway at school, and I know they have cameras and they won't let me see the video. And schools are not allowed to share anything that has personally identifying information about another student, even if that student is a bully, with a parent. And that's important to know. So parents really do need to document and take note of when their child tells them incidents have happened, who might have witnessed it, take pictures if there's physical evidence at all of what happened. The screenshot method, as Becca was mentioning, any kind of data and documentation that the parent can gather. So we have resources on our website that will help the parent assemble those and know how to report things appropriately. And again, how to follow that chain of command and who to involve when, so that they can help their children and help stop that bullying and then prevent it from happening again. So it really is everyone's responsibility, but especially the adults in the room, right? We want to equip our children, but because we are aware that children with disabilities are especially vulnerable and may not have the resources to advocate or deal with the situation completely on their own, then we need to be responsible for helping to prevent and deal with bullying when it does happen. So, thank you for the opportunity to talk to you. And at the Utah Parent Center, we're available for parents and professionals alike, anybody who might want to call and ask questions, look for resources, we're here.
Thank you, Michelle, as well. It's great to have the perspective for those with children and youth with special healthcare needs also. And we have a couple minutes for questions. I'm gonna go ahead and reshare my screen just so we can start our meeting evaluation.
Great, thank you.
While we take a few questions. I'll just go ahead and launch today's meeting evaluation. And then if anybody does have questions, you can throw them in the chat or just unmute yourself and ask in the last few minutes that we have here.
Yeah, I think I deal with the education side at the Utah Parent Center. Colleen is over on the healthcare and community resources side. And so the experiences that I have had with bullying mainly relate to what can be done maybe in the IEP or a 504 plan to address that. And I guess it is important to know that things can be done and implemented as part of a plan to help with that.
Sorry, I just see it's launching my poll I had earlier, so I'm wondering if
I can't access the chat either, Athena, to see if there's
Okay.
anything in there. It's
nothing's
not
coming yet. It looks like yeah, I'm not sure how I'm able to get the other poll up for our evaluation. Here we go. Try this. There we go. There's our meeting evaluation. Okay. So I'll just keep an eye on the chat for the next few minutes. As you're filling out the evaluation for today, I did just a reminder that our next meeting will happen the third Wednesday in September. It'll be September 18th. And our learning session for that day will have somebody from Pingree Autism Center for Learning come to talk about programs and services. So that will be our meeting topic for September. I think initially on the schedule, it was down to have Medicaid come and talk about waivers. We're hoping to do that presentation still, but it will likely be a little bit later in the year, maybe October or November. So that will still be to come, but we're sometimes it takes a little longer to secure presenters for things. So great. Looks like people are filling out the evaluation, and I got to figure out this timeout thing. It keeps again. I don't know what's going on. I feel like that's a new thing, so I'll have to look into that. But we'll relaunch it one more time and just see if we can get a few more responses there. But I didn't see any questions come through the chat. So I think that is our meeting for today. Thank you, everybody, for coming. And we'll plan to see you all again in September.
Thank you. Bye-bye.
Thank you.